Okay, so today we will be discussing Chapter 3 of Nursing Informatics, which will discuss issues in informatics. Issues in informatics. Now, class, for this topic, class, we will have six what we call this subtopics, no? But we will only discuss the first three today, because the first three is part of your prelim exam. Okay, whereas the last three is already our first midterm topic. Okay, so today we will discuss nursing informatics and healthcare policy, the role of medication in the the role of technology in the medication use process, and healthcare data standards. Okay, let's begin. Okay, informatics and healthcare policy. Now, to practice effectively in today's continually changing healthcare environment, informatics professionals need to be aware of existing and proposed healthcare policy. Now, class, a policy is a course of action that guides present and future decisions. Okay, when we say course of action, class, it means this is our standard operating procedure. Okay, like our rules. Okay, now class, healthcare policy is established in a local citywide or by city, and a national level. Okay, they could be established locally, like for example the policies that is specific to a certain hospital. Okay, it could also be citywide, like for example Cebu City has a different healthcare policy compared to another city. And next is national. When we say national, it involves the general policies of the entire country. Now, here is the thing. It is a course of action that guides present and future decisions. Now, what does this have to do with informatics? Okay, it has something to do with informatics, specifically when we say future decisions. Now, as the years go on and as technology progresses, the more data we accrue or we get through technology, such as the methods we've already outlined in the previous topics, no, like ito mga electronic health records, there will need to be changes in the healthcare policy. One immediate example that would come to mind is how this data would be secured electronically, di ba? Because as we've mentioned before, no, the use of technology has their downsides. One of those downsides is data privacy, no? The data stored in an electronic health record might be more vulnerable simply because there could be bugs or glitches in the system. Okay, so that is how one way it could affect the policy. No, it could because there is the use of new technology, it could change how we store our data, or what kind of guidelines we need to use to store the data. Now, in order for nursing informatics to be acknowledged as a specialty, nursing informatics had to, number one, demonstrate a differentiated practice base. When we say differentiated practice base, class, it means that it has to be unique. It has to be different from other nursing practices. Okay? Like for example, class, we have our renal nurses, di ba? We have our operating room nurses. Each of those specialized practices have their own guidelines. They have their own rules, they have their own policies. Now, in order for nursing informatics to be considered a specialty, we as nurses, no, or the nursing informatics community in general must be able to tell or provide their own policies, di ba? Provide their own policies, their own guidelines in order for it to be considered a specialty. Another is to identify the existence of educational programs. Now, since, di ba, we've mentioned before, no, that informatics is somewhat a newer, no, mura siya mas bago or a newer specialty, di ba? As we mentioned in 1992, it was a time when the American Nurses Association deemed that informatics was a specialty, di ba? We already mentioned that, no, since it is a newer or infant specialty, we must be able to also identify the existence of educational programs in the field. Now, when we say existence of educational programs, what I mean by that is something like this. When we say there is a nursing informatics class in your bachelor's degree course, di ba? Karon nag-nursing mo karon atay nursing informatics class. This class, no, kanatong klase karon. That is not what I mean. Okay? When we say existence of educational programs, it must be specific to nursing informatics, wherein it will not only discuss the theories or the major applications of nursing informatics, but goes deeper into it as a specialty, no? Di ba? If we say nursing informatics class, there could also be subspecialties, di ba? Like mga specialized informaticists, no? There could be one for, let's say for example, data management, di ba? There could also be one for let's say for example, data extraction, or let's say for example, another could be what we call data analysis, di ba? Now, identify that there is the existence of educational programs. Now, as far as I know, it is not yet apparent, no? It is not yet, like for example, discussed more in a bachelor's degree. But as I've read, some master's programs, they do offer what we call advanced nursing informatics courses, no? So that could qualify, as an existence of an educational program. And lastly is develop a research agenda. Now, when we say research class, the primary purpose of research in nursing is, and you should always remember this when we are talking about research, the primary purpose is to improve the nursing practice. Okay? To improve the nursing practice. Now, when we say research agenda for nursing informatics, we are gonna ask the question, for example, how do we make nursing informatics better? How do we make nursing informatics better? Now, obviously class, no, there is a lot of byroads when we say that. Okay, we could use or we could integrate the use of artificial intelligence when it comes to our data management. Okay, we could integrate the use of what we call personal wireless devices, di ba? Like our cell phones or mobile phones or mga tablets, di ba? When it comes to developing new technology or new methods, no? So, yes, that is it. Redevelop a research agenda. Okay? So, here are the following issues in nursing informatics. First and foremost is interoperability and standardization. Now, one of the significant challenges, class, in nursing informatics is the lack of interoperability and standardization among different health information systems. For example, class, let's say for example, class, this is hospital number 1. Okay, example lang ni class, ha? This is hospital number 1. Okay, and this is hospital number 2. Ayan. That is hospital number 1. This is hospital number 1. This is hospital number 2. Now, let's say, for example, class, they use different health information systems. Different health information systems. Now, Let's say for example class, ganito yan. Let's say for example they use Health Information System 1 and they use Health Information System 2. Example lang yan class ha. We do not have specific brands no or specific programs yet. Okay? Yes, mga na siya class. When we say interoperability class, what we mean by that is the data or how the data is gathered in this one or in the Health Information System 1 should be easily be migratable to Health Information 2. Yan na sa class. When I say easily migratable class, it should be easily understood by Health Information 2. The problem there is this. Health Information 1 will probably use a different standard to Health Information 2. Like for example class, let's say in HIS1 they use Fahrenheit. Okay? In HIS2 class, Health Information System number 2, they use Celsius. Now, if for example we are gonna migrate it raw, okay, when we say raw, we are just gonna move the values from the chart in HIS or the electronic health record in HIS1 directly to HIS2 without conversion, we would get something like if 101 degrees Fahrenheit class, when it migrates, it will be 101 degrees Celsius, which is obviously very hot, boiling hot. Now, that is a very crude example of something that might not happen. An example of something that might happen is something like this. Let's say, for example, Health Information System 1 uses what we call a checklist type of approach to their assessment. Diba? Checklist type of approach to their assessment. Like for example, class, when you say, yan na siya, palpable lymph nodes. Okay? Palpable lymph nodes. Now, when we say checklist assessment class, no, it is the type of charting where we just check, di ba? You may kasi ka-encounter na gurumana, no? We just check. But let's say for example class, HIS2 uses what we call a narrative charting. Okay? Example na tanan ha. Okay, narrative charting. When we say narrative charting class, diba, essay man na, essay. Okay, the lymph nodes are palpable, they are non-movable, immobile, around 0.5 to 1 inch in diameter. Diba, murang nga na ba, no? Now, when we say interoperability, if for example the patient is admitted in this hospital which carries HIS number 1 class, and then they transfer to a hospital where there is HIS number 2, there is no easy way to convert a checklist assessment into a narrative chart, diba? So dili sila magkatugma. Although the information is there, but the conversion between information is not there. That's why there needs to be a set standard. For example, if all electronic health records class, for example class, if all electronic health records could agree that a narrative type of charting is best, then HIS number 1 would chart them narratively, and when the patient transfers to a hospital with HIS2 or another brand of health information system, they would also use a narrative type of charting. That way, if that is the standard, when the patient transfers from this hospital, their information will also easily be able to be transferred to another hospital, and thus reducing confusion. Okay? The problem there is this. Okay? If, for example, class, there is no standardization, it can oftentimes lead to what we call fragmented patient data. When we say fragmented patient data, magkuwang-kuwang. Di ba? Like, for example, narrative checklist charting, di ba? It was just a normal check, no? It was just a check to see that the lymph nodes were palpable. But when they transferred to another hospital using a different type of health information system, what are we gonna write? Diba? Ito is what dito is, the lymph nodes are palpable rapod, and then the problem there is kuwang na. There is lack of data. Aside from that, another problem with the lack of interoperability is inefficiencies and potential error, no? Which potential errors, which adds a more workload for the nurse. The exact thing that we are trying to avoid. Okay. Excuse me. Okay. Next is data security and privacy. As we've already discussed, no, using an electronic system or a technology-based system has its flaws. One of those major flaws is the possibilities of intrusion or hacks. Baka nang ma-hack ato mga system. Intrusion. Another possibility is the bugs or glitches that could often leak data. No? Data leak. Okay? The problem there is this, di ba? Usually when we are doing assessment or other types of data collection in the hospital, chances are that information is sensitive, di ba? Health information is sensitive. And if we break, let's say for example, that confidentiality, it can lead to confidentiality violations, possibly even lawsuits, no? So, normally there is a regulation that governs this, no? One common regulation used in the United States is the HIPAA, or the Health Insurance Portability and Accountability Act. Okay, I will discuss later what the HIPAA means, but in the meantime we will continue. Next is training and education. Now, the reason why this is an issue in nursing informatics is that nurses, guys, require adequate training and information to effectively utilize informatics tools and technologies, diba? Especially if the nurses you are training are, shall we say, not technologically inclined, no? For you or for this generation, the training might be a lot easier because most often than not, no, ang atong generation, we are imbued with technology, so we understand the systems, no, the hardware, even the software sometimes, di ba? However, many nursing programs do not fully integrate informatics education into their curricula, leaving nurses ill-prepared to leverage technology in their practice. Now, a solution to this class is through continuous education and professional development by way of our postgraduate degrees and possibly even kanang atong mga conventions, no? Aside from that, the reason why training and education is a major problem in informatics is because it leads to more cost and more training time, di ba? It leads to more cost and more training time, and thus if magsige kag train, there is a tendency, no, that there is what we call mag-shortage, no, so sa hospital, di ba? Because let's say for example, you need to get 5 nurses out of rotation so that they would train about the new system for a week, di ba? That is 1 week without those 5 nurses, di ba? Aside from that, no, training is very expensive. Training is very expensive, very time consuming. Okay? Next is user interface design. Now the problem there, class, is when we say user interface design, no, it is the software itself and how it is laid out. Okay? How it is laid out. Now, a poor user interface design, an interface design that is very slow, very clunky, can lead to frustration, errors, and inefficiency. Diba? It can lead to frustration, errors, and inefficiency. No, so one way we can solve this is, as nurses, no, if if you are given the opportunity to help in the development of a health information system, please do it, because the tendency there is this: most of the time it is not the nurses who are developing these systems. Okay, dili man ta mga IT, di ba? We do not have the courses necessary to program, no, or code the following systems. So if you are given the opportunity, or if we are given the task, no, to help design the interface, then go for it. Okay, because we know what is best, di ba? Like for example, class, let's say for example, the monitor looks like this, class. That is, muna siya itong monitor, ha. Okay. And then, class, ang temperature slider, class, ang atong temperature, class, it is charted like this. Let's say for example na ay line. Mari diri, class, 35 degrees. Mari diri, class, 40 degrees. Now, let's say for example, the way we input temperature into a computer, class, is by manually placing a dot somewhere in the graph. Now, class, for some, that might be an inconvenience, no? Like for example, di ba, you have to use your pointer or your mouse pointer to manually click on the area where the temperature or corresponding to the temperature. Now, that is a very inefficient method. Di ba? Imagine na magsigag pangita diha. And it also, ang tendency na is if you're gonna use something like this, it's gonna be very inaccurate, di ba? Because you have minor or minute kana mga gaps, no? Kana mga 0.1, 0.2, 0.3. These are very minute. So, that is bad user interface design. Although it looks great aesthetically, it does not help us when it comes to efficiency. Instead, a user interface like this, class, like for example like this, where it is just a box where you just type the numbers. Let's say for example 37.5. That is more efficient. That way, class, we only need to type. Okay, dili na tayo magmanumanog. We do not need to manually click the exact point wherein the temperature is correct, di ba? That is good interfaces. Actually, class, this is even bad. Okay, we can just, if we are given the opportunity to design, class, we have to design it like this, square. Okay, and then ngari Celsius, so that we don't need to type the Celsius anymore. We just need to type the number 37.5, di ba? If bad gani ang user design, no, it can lead to a lot of frustration, no? So that is an example of how bad the user interface design can affect our implementation of informatics. Next is resource allocation and budget constraints. Now, class, as I've said before, the use of technology, especially when we are implementing and maintaining nursing informatics solution, requires significant financial resources. Okay? And most often than not, class, healthcare organizations are budget constrained. Okay? Walay kwarta. Okay? The problem there is not only implementing. The major problem there is maintenance. As I've said before, kana ato mga IT, kana ato mga computer engineering class, kana mga computer engineers na to, class, they are very expensive to keep on the payroll. Okay? Now, in the long term, class, this is a great investment for the hospital in the long term, because the tendency there is this: if the work is efficient, there is an increase in what we call worker job satisfaction. Di ba? Malipay ang mga nurse, ay, sayo na lang mo trabaho. Easy na lang, kay more on kuano. So if there is increased job satisfaction, there is increased retention of employees, no? The problem therein lies is the upfront cost, di ba? Mag-implement pa ka, you're gonna buy computers, one for each station. Not even one, basin gani daghan na siya, multiple for each station. Aside from that, you have to buy the supported systems or the auxiliary systems used in the for informatics, no? Like for example, if you're gonna implement a, let's say for example, atong istoryahan class, katong BP apparatus that automatically pumps at a certain time and sends the result back to the station automatically, di ba? You have to buy those as well. Buy one for every bed. Aside from that class, we also have to maintain them. Aside from that class, we also have to give each and every individual person or healthcare team member who is appropriately responsible for the care a device that you can use. To take advantage of this this system, no? So that's why there is a problem, especially with resource allocation. The ending nga na class is ang maigo na usually is the patient, because they will cover the cost, di ba? Sila may muguan na, no? So, yes. Now, the Health Insurance Portability and Accountability Act was passed in 1996 and is intended to improve public and private health programs by establishing standards to facilitate the efficient transmission of electronic health information. Now, we have a few key components of the Health Insurance Portability and Accountability Act. The first is privacy role compliance. When we say privacy role compliance, class, nurse informatics professionals must ensure that electronic health records and other health information systems used in nursing practice comply with the HIPAA's privacy rule. Okay? This includes implementing appropriate access controls, authentication mechanisms, and audit trails to protect the patient's privacy and unauthorized access to their health information. Now I want to highlight what I've said, no, which is access controls, and the other is authentication mechanisms. Okay, when we say access controls, class, it means that, for example, there is a device for every nurse in order for them to access this information. When we say access controls, it means that only the nurse should be able to access that device. Okay? If, for example, this tablet was given to me, I should be the only one to have access to that tablet. Okay, that is access control. The problem there, or the potential problem there, is this. What if, class, ikaw, class, tanga ka na nurse? Patay, tanga ka na nurse, class. The problem there is, what if you leave your tablet in the station? Okay, what if you leave your tablet in the station? And then suddenly, class, a bystander, let's say for example, a significant other of a patient walks to the tablet and then starts reading a patient's chart or a patient's electronic health record. Now, that way, class, no, wala na tayo access. No, they are now given access. No, that's why we have access controls. One of the main methods we use for access controls is, let's say for example, logins, diba? Logins like username and password. No, every time we check a chart, username and password as we type so that we can actually check the sensitive information. However, we also have new types of authentication mechanism, because that is an authentication mechanism. The first authentication mechanism that is very new, fairly fast, is the use of biometrics. Like for example, class, ka na mga fingerprint scanner. Okay? And pwede gani ato mga iris scanner. Kana mo scan sa itong mata. Okay? When you say biometrics, no, let's say for example you have a tablet, and that tablet contains the electronic health record of all your patients, no. In order for someone, let's say for example another person, to access that information, you must be there present with your biometrics to authenticate them. Okay, that way class, there needs to be, dapat na-adjug ka there, you need to be there, no, so that there is access. Another authentication mechanism that it is also very common is a what we call a key device. Okay, a key device. For example class, let's say imong ID. Okay, imong ID mo ni siya, imong ID. Okay, and then mo ni siya ang imong tablet. Now let's say for example class, in your tablet class there is an RFID scanner. Yang nga class, there is an RFID tag. Okay, now let's say for example class, when you log into your, for example, log into your tablet class, you need to scan your RFID tag first, so that you can access the information in the tablet. That is what we mean when we say key device. Now it could not be it could not be easily accessed, no, without the appropriate device. But the problem with using a key device is that it could be stolen, basin makawat. Aside from that class, it could easily be spoofed. Okay, when we say spoofed, if for example there is a very talented hacker, they could what we call this, access or steal the signals, no, steal the signals of the RFID tag and mimic it, mimic using another device, usually a phone, to gain access to your tablet. Okay, so yan. Next is security rule compliance. Now, the HIPAA security rule requires covered entities to implement safeguards to protect the electronic health information from security threats or breaches. Okay, nursing specialists play a vital role in implementing and maintaining security measures. Okay, now class, we play a vital role in this instance because we are the ones holding the key, diba? We are the ones who have access to our biometrics, access to our key devices, so on and so forth, no? So when we say security rule compliance, it means that we nurses should be vigilant about who gets to access our data, the patient's data, diba? We have to be vigilant. So for example, na ay nurse na moduli mo, they are not part of this specific patient's healthcare. Now we do not give them access to this data, okay? But for example class, a physician comes to you, and this physician is the one that is directly caring for the patient under you, and they ask you, let's say for example, mauta na sila about a specific information and they want to see your tablet, then you have the access to, you can allow them to check or not, di ba? Ikaw may mamahala, no? That is security rule compliance. Next is access control, no? Access control. Now, nursing informatics systems should incorporate access control mechanisms to restrict access to patient health information based on the principle of least privilege. Now, a common or a key thing here is what we call our role-based access controls, diba? As I've said, no, to restrict access to patient health information based on the principle of least privilege. That is the key term there, least privilege. Now, let's say for example class, there is for example four staff members in the hospital. The physician, okay, the nurse, The nursing, let's say for example, ato na lang ibutang class, nursing aid, ayan. And lastly class is the janitor. Oh no, janitor, not janitor class, custodian. Ayan, custodian, okay? Custodian. Para social pod ba? Custodian class, mura na sa lag mga janitor. Okay? Custodian. Ayan. Ang galing. Okay. Now, when we say role-based access controls, it just means if, for example, the information is, if, for example, your role gives you a privilege to access the information, then you will be given access. Like, for example, class, let's say, for example, for health, let's say, for example, for sensitive health information, class, or very sensitive health information, the physician and the nurse can access that, but the nursing aide and the custodian cannot. Okay, but for basic health information class, maybe the physician, the nurse, and the nursing aide can access that, but not the custodian. Okay, but let's say for example class, room number, kana room number, okay? Yung gitag room number class, dapat kabalusad ang janitor ana, di ba? They should be able to know the room number, di ba? Let's say for example, okay, suguon na yung sugos janitor ato adito si kuan, si room kuan na siya si patient, no? So maybe they could be given full access, no, when it comes to room number, no? So that is what we mean when we say role-based access control. If your role gives you the privilege to specific information, then you will be given access to that information. But if your role does not give you the privilege to this information, then you will not be given access to that information. Diba? That is role-based access controls. And lastly, class, is audit trails. Audit trails, class, the HIPAA mandates the implementation of audit trails to track access of patient health information and monitor for unauthorized or inappropriate use. Okay? Nursing informatics systems should generate a comprehensive audit log that records user activities, including logins, access attempts, and modifications to patient records. Let's say, for example, class, what we mean when we say audit trail. Naala sa system, class. Let's say, for example, there is a system there called log. Okay, a logging system. Kana itong system that tracks, no, changes. System that tracks changes. Now, let's say, for example, class, ikaw na po to, class, balik na po to, class, tanga na nurse. Okay, tanga na nurse. Let's say, for example, class, you charted there 39.5 sa imong temp. Back. The log will chart there nurse, let's say for example nurse Justin, patay ako ni tanga na nurse, charted 39.5 at 4:15 p.m. kana muna si log. Okay, it kept track of what I charted. Now the problem there is this: what if tanga manggud ko na nurse? This is actually a wrong information, sayop na information, class. Okay, tanga ba ako na nurse? In reality, class, their temp was really 37.5. Patay. That is the real temperature. Now me as a nurse, no, I want to keep my records concise, I want to keep my records clean. Okay, so ako i-reason, I will change the result. I will keep it 37.5 degrees Celsius. Okay, now class, in my mind, feel na ko, class, that I have already fixed my mistake. Diba? In my mind, I have already fixed my mistake because ako naman gilisan, diba? From 39.5, I have already fixed it to 37.5. Now, the reason why there needs to be audit trails is something like this, diba? I changed it. So, mulag po na dito, it will also lag. Nurse Justin changed temp from 39.5 to 37.5 at 4:17 p.m. Now, kaingon ko, di ba? I already fixed my mistake. The problem there is this. Let's say, for example, there is an audit. Okay, audit. There is an audit. Audit gani class. We are now checking the records, no, to see if there are inconsistencies in our, let's say, for example, operating procedure or our standard operating procedure. Now, when the auditor kana mo check ana class, sees the log, makita niya ang akong log, makita niya class that I changed or I cheated. Okay? I cheated I changed my wrong or my error to a new correct value. Makita niya na ako nagiayad, no? And therefore, maybe they might conclude na, ngano wala man report. They might conclude, why is this error not reported? Ngano wala man incident report? That is a major mistake, di ba? As we've already said before, a health record is a legal document. No? So that is the reason why we should have audit trails. It is to check and see if there is inappropriate use or unauthorized use in a patient health information system. Di ba? Nilira na ka na, di ba? Since it also charts the name of the nurse, maybe, let's say, for example, class, there are other nurses that might change the value para dauton ka. Di ba? So that's why there is an audit log. It is like, it is very comparable to what we call a black box sa kanang aeroplano, di ba? A black box in an airplane logs all the data included in the flight system para makita na to, or so that we can see the result of a crash, okay, or the result of a malfunction during flight. So, mura na siya nga, no? It is to see if there are mistakes made that are unreported. So, yan. Next is the role of medication or technology in medication use process. Due to numerous steps required in the care of a patient, the process is inherently considered error-prone. Okay? Diba? When we say medication preparation, kasi daghan kay steps, diba? We have to check first, and then we have to check the expiration, and so on and so forth. Dapat ma-check na ito ang name, ang dosage, ang calculation, dapat correct. There is a lengthy process, and because of that length, there is lots of areas, lots of times where there is a risk for an error, which makes it error-prone. Diba? It is an error-prone process that is fraught with mistakes which may occur. Okay? Normally, class, if competent nurse ka class, no, you will remember all the steps, you will do your due diligence, and you will actually do it right. The problem there is this: even if you are the most competent nurse, ikaw may pinakahanas, class. Okay, ikaw may pinakahanas. After, let's say for example 14 hours in your shift, maglipong-lipong na jud ka, diba? You will be feeling dizzy. Okay, aside from that, you will be feeling very tired, and you might miss a couple of steps. That's why, class, no, our goal here in informatics is to use technology in order to make nursing or the nursing practice as efficient and effective as possible. That's why we often use some systems, a few systems that can help us, no, specifically in the medication use process in this instance, diba? So we have four common methods in electronic medication processing. Okay, the first is a computerized prescriber order entry, barcode-enabled point-of-care technology, automated dispensing cabinets, and infusion pumps. Okay, the first is computerized prescriber order entry. Ineligible handwriting on medication orders has been shown to be a common cause of prescribing errors, which leads to patient injury and even death. Di ba, class? Common ka na, class, especially ka ng mga doktor, no? Mga doktor dito, mga sila dito, class, patay. Sila. Patay naman. Ikaw dito na nurse ka, tanga ka. Unsa man ang gi-prescribe ni doc? Unsa man ang gi-prescribe ni doc, di ba? Ang akong naibawa na class, all I'm seeing is M. Mura na ako makita, no? And I always kita sa nako diri class. Kana the dosage sa siya class 50 or is it something else? Maybe 7 na siya class pero natanga lang ang doktor, no? Nagdali siya suwat. Okay? That is ineligible handwriting, di mabasa, di ba? No? So that is a common cause of prescribing error. Now, when we say computerized prescriber order entry, what we mean is, for example, if the doctor orders a medication, instead of writing it, or isuwat dito class, butang siya dito class, patay. Butang siya dito class. Instead of writing it, metformin. Ayan. So na met. Ay, di mo na mabasa, di ba? That is ineligible. Instead of doing that, we will use computerized order entry or computerized prescriber order entry. Instead of them writing the order, they will just type it. Di ba? Because if it is typed, kung tarong ang pagka-type sa system, it is very, very readable. Di ba? So, in that vein, class, it will decrease medication errors. The use of CPOE has the potential to alleviate many of these problems. The problem here is this, okay? The problem here about this system is validation. Normally sa hospital class, when they order, ano na siya class, doctor's order nga rin. Doctor's order. Ano? Kasi for example, kasi doctor will chart their metformin siya. Ang bati na agi ka na metformin. Normally class, after they do that, metformin. Okay, normally, after they give a doctor's order, they will stamp it. Gamitan na lang through that. Okay, gamitan na lang through that. The doctor ko na license number. And then they will sign it. Okay, that is to signify that they are the ones who gave the order. Now, the problem with CPOE is that we need to integrate authentication systems to determine who has given that order. So for example, ay doctor dito class. There is a doctor there and they will type metformin for patient kana. Metformin for patient 1. Patient 1. Okay? Aside from typing that, we need to confirm na sila gid na sila, di ba? Sila gid ang ni order. So, in that instance class, we may use access controls. Like for example, biometrics. Ato siya. Okay sir, okay doc, after ni mog type sa order doc, please ikuan lang doc, butang lang ang imong fingerprint so that we can verify nga ikaw din nakatag sa order, or so that we can have evidence, no, that you gave the order. Di ba? No, so muna siya, maybe pwede po to device key, di ba? So muna siya, that is a problem, but generally this is more efficient, no? More efficient. It saves on paper waste, it saves on saves on efficiency, it saves on time, and aside from that, majorly, no, it will prevent, no, errors in prescribing. My God. Next is barcode-enabled point of care. For more than 20 years, barcode technology has clearly demonstrated its power to greatly improve productivity and accuracy in the identification of products. This could also be used to accurately prescribe medications, especially branded ones. Now, diba? This is very obvious, no? If we want to, let's say for example, we want to buy a certain medication. Okay? In the US, kabantay mo, I don't know if you've seen in the US, but in the US class, they give discrete medication box kana mga containers. Kana bitong malay mo usually na ni mga names. Now, we can use barcodes, di ba? Scannable barcodes. If we use barcodes, the good thing about barcodes is that it is mostly universal, di ba? When I scan a medication, I know that when I scan it, ang mugawas is ang katod yung tambal, di ba? No.